Hello, everyone, and thanks for joining today's webinar, The CIO Perspective on Enterprise-Grade AI for Healthcare. Before we begin, I'll walk us through just a few quick housekeeping instructions. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. And finally, if at any time you're having issues with the audio or visuals, please try refreshing your browser. You can also submit any technical questions into the Q&A box, and we're here to help. With that, I am pleased to turn the floor over to Guru Sundar, the Vice President of Marketing at Abridge. Take it away, Guru.
Hi, everyone. My name is Guru Sundar. I'm the VP of Marketing at Abridge, and it's an absolute privilege to be here today with Dan and Terri, and we're going to explore many different aspects of AI as it stands for where we're at with healthcare, the evolution of how systems are adopting AI, and many other interesting topics. So with that being said, I'd like to take a minute to allow Terri and Dan to introduce themselves. Terri, let's start with you.
Good afternoon, everyone. I'm Terri Couts. I'm the Chief Digital Officer at the Guthrie Clinic. I'm a nurse by background and started my career as a pediatric intensive care nurse, specifically around pediatric hearts. Also spent some time in the NICU, and I'm really excited to talk with you today about how technology is transforming healthcare.
Dan?
Thanks, Guru. Pleased to be here with you all this afternoon. My name is Dan Exley. I serve as the Interim Chief Information and Innovation Officer here at Sharp Healthcare in San Diego. I've been working in healthcare my whole life. I started as a candy striper when I was 15 years old. And as I said to somebody the other day, I've been working in healthcare my whole life and I still love it. And I think that's a pretty succinct summary. Healthcare IT for most of the last 25 years. It's been really exciting and a privilege to be right at the forefront of some of the interesting innovations we've seen, whether it was, the new wave of EMRs that were deployed there, starting with the big project I did at Evanston, really learning how to do something with all that data and moving into the analytics space and sort of that big data wave that we had a decade ago. And right now, this time is maybe even the most exciting of all. Where we are really seeing ways to provide advanced computing capabilities to our clinicians, to our patients and their families in ways that are really winsome and exciting and endearing. And we haven't had that part of this before where we were empowering, we were digitizing, but it's been a lot of work. And right now it's still a lot of work, but the end product for the folks that are expected to use and benefit from these really has a different flavor to it. And there's a positive energy around that. And there's pull from our clinicians and from our patients, which cues up for us as technology professionals, much more to be done. So really excited to talk about that with you guys today.
Awesome. Well, we're in the middle of a very exciting transformational time in healthcare. I've been in healthcare for a minute as well, and I've never seen technology being adopted at this pace and velocity and energy. And so I'd love to get both of your perspectives from the perspective of your own system and where you sit, like where are we from an AI adoption, on the AI adoption curve? Terri, let's start with you.
Yeah, I think we are definitely at an inflection point, and it's exciting to see how healthcare is moving from kind of the experimentation of AI to the actual operation. At Guthrie, we're very intentional about this, but just like many of my peers in the industry, we're seeing AI shift from being an innovation kind of topic to being more foundational. And that's really focused around care delivery, workforce efficiency, and patient engagement. I think the difference now is that organizations are no longer asking if, but really using AI as how and when it can drive the most value quickly. The focus is on scalability, repeatability, and those use cases that actually drive the outcomes that you're looking for, like ambient documentation, clinical decision support, patient triage, those kinds of things. And I think that it's no longer just pilots. It's really tied to metrics. It's integrated into workflows, and it's co-owned by clinical and operational leaders, which is really exciting for me. I think one of the key drivers is trust. And clinicians are really starting to see those real outcomes and not just demos. And solutions like a bridge are a great example of how we're showing that when you co-design with clinicians, there's a focus on reducing burnout, that adoption really follows. So I think we're still at the early stages of that broader curve, but I think the acceleration is really real. And the systems that are building governance and infrastructure and change management muscles around AI is really the ones that are going to be leading in the next phase.
That's
I completely agree. Terri, that getting it right and getting the fundamentals in place has been a lot of work for our organizations. I was sharing with somebody earlier today. We kind of started from scratch in some regards. We have IT governance or organizational governance or our compliance and risk management programs, but they're not sufficient to address the sort of cadence, the rapid pace of this, and also the real significant just differences that we're facing as an industry and as an individual organization. So similarly at Sharp, spending better part of the last 2 years, not only the experimentation and moving into now over 20 solutions in production that are really yielding value, but doing the education of the multidisciplinary teams that need to be at the table to help us figure out how do we get it right and have the right rules of the road and the right endorsement from our board of directors down through to the frontline staff that this is really good for us and we're doing it for the right reasons so that we don't have those sort of negative halo effects that you might otherwise experience if you didn't do that work up front.
Yeah, I'm hearing, there's obviously an importance of having a platform that can meet the system needs, across the board, different care settings, different specialties, and just the IT requirements of a specific system. But I think, Terri, you touched on this, and this is near and dear to us. Like our CEO and founder, Dr. Shiv Rao, is a practicing cardiologist. So he keeps that like voice of the clinician at the heart and central to what we do. One thing that matters to us a lot is making sure that we're not solving one problem and then introducing new problems. And I think understanding the clinical workflow impact and integrating into that has been a big part of how our partnerships together have succeeded. We talked a little bit around the evolution of where we're at, but you both alluded to the fact that we're beyond the days of some of those like early pilots, et cetera. Like we are in scale stage. And so as you evaluate solutions that not just perform in a pilot, but can perform at scale, what is top of mind? And Dan, maybe let's start with you for this one.
Yeah, I think safety is first in our minds here because of the many evidence, the large body of evidence of how AI can go bad, right? We unsupervised or not thoughtfully deployed. There are plenty of instances where we have some of the challenges with confabulation or other challenges. So making sure that the solution is really fit for purpose and safe is right up front. And then it's going into a second stage of looking at the usability and the implications for the total workflow. So really looking at what are the largest problems that need to be solved where AI could be a tonic, and then trying to figure out how we fit that in. And it's no surprise that with what we've done with the bridge has been right towards the front of some of that work and scaling out into production so broadly, because the burnout challenge for our providers is so real, so real. Our providers have been desperate for help. And our physicians are the ones who have told us for decades now, as we've done things that were important to do, the digitization of healthcare. Terri and I were both there when you rounded through the unit and you'd have to go find the chart. And then you'd have to find out what the heck this thing says. And you'd find the one nurse that that knows how to read Dr. So-and-so's handwriting. That definitely says this. So we moved past that. And that's super important. But we also have plenty of evidence that the burden has shifted and the documentation burden or the secretarial work or the operator of a computer work has been loaded onto our clinicians in ways that's just completely unsustainable. So the partnership with the Bridge has been huge because it's taking a lot of that burden off of some of our most critical care team members who have been experiencing burnout for so many other reasons, societal, beyond the tech burdens that we've been placing on them. So that's exciting. And that's an example of the outsized impact that a well-deployed AI solution can bring. So now as we're looking at some of our next big opportunities, that's where we're saying, gosh, We have these things which are really manual, but we still have opportunity here. But you have a workforce that is just drowning in work, right? There's so much administrative burden in healthcare. How can we help them do better, feel better about their work, and be more effective? It's an engagement tool for them as well. But you look at some of the things we're looking at right now, in addition to our clinical settings, and the back office functions that we have are vast. To operate a healthcare organization in America right now takes tremendous back office burden, as we all know. So looking at those and seeing how we can equip those, whether it's something like a Copilot or some other sort of assistive tool, that's where we think we're going to see some meaningful work. But again, now you're starting to see we're helping clinicians, we're helping administrative functions, and then in the interstitial space, the folks that work in our contact centers and the rest, just ripe for opportunity. And the cost is going to come along, and that's where we're going to manage and make sure that we've got the right benefit and safety, and then really yield out how we evolve the way that we operate our organizations to balance it out. So we're not just loading costs on top of everything else. We really need to evolve how we're deploying our workforce in ways that are different as we're empowering them with new tech.
Awesome. What about you, Terri? Where, when you look for scale, what are the things that are important to you?
Yeah. I mean, a lot of the same concepts that Dana spoke about, but when we're evaluating AI solutions for clinical environments, scalability and enterprise suitability really come down to a few things for us. Workflow integration is a must. That is foremost. It's a no from the start if it's not integrated into their workflow. But I think we really need to take a hard look at security. That is a top priority for us. And, AI is built on data, and data is one of our most valuable assets, and we have a lot of it. And so we need to make sure that it's secure, and understand the vendors that helping support that. I think second, versatility really matters. A solution that only addresses one single use case really is not something that we're going to be able to afford in the long run when we start adding on all these use cases. As Dan alluded to, this is only going to continue to grow. And so how do we look at platforms that can help us scale to many different use cases to kind of create that financial benefit that comes with the actual clinical outcomes? And I think third, really, the alignment with the vendor's vision is also critical for us. We really want to make sure that we have true partners, that we can evaluate whether the company is like truly focused on solving healthcare challenges as a whole. Do they understand us? Do we understand them? Are we kind of walking in sync on how we're going to innovate? And is that something that we're innovating together, or is that something that's not going to work out? And so one of the things that we've had an example with the bridge is participating in the advisory group for me and being able to kind of give my input and some executive updates on how you guys are working through things, how our providers are using a bridge, and just having that alignment. Not only are you listening to us, but we're hearing you too. And so walking in step, I think that's really important for us as well.
We're in the business of like elevating the value of the conversations, and the conversations are happening at multiple levels, both at the patient clinician side, but also as on the partnership side. You both talked a little bit about trust, and that's something that we take very seriously. In both of the situations, we went through a very extensive process with both of your systems to initiate that and create a foundation for trust through some of the rigor and evaluation that you do. But how do you continue to maintain that perception of trust as you continue to use a platform over the years to come? And Terri, let's start with you.
So I think, we're a very risk-averse industry. We're slow to adopt these things because there's a real consequence on the other side, which is patient harm. And so, none of us want to experience that. And so I think trust goes back to that partnership that I was talking about a few minutes ago, but then also, making sure that you align to the outcomes that you're driving towards. So having a real use case, understanding how the models are trained, making sure that you have influence on that training, and then also having a strong governance around how do you monitor that long term. You hear all these things about shift and hallucinations and all these scary kind of words, but it's real, and you have to have some governance around that. But I think trust really comes down to understanding where the data is going, understanding how the data is being trained, and then monitoring that. It's no different than what we've done with clinical decision support, even all the way down to order sets, right? You have to kind of monitor that and have an upkeep. AI is no different. And I think proving out those outcomes and then having a strong governance process around it is really where the continued trust comes.
Dan, do you have anything to add there?
Well, just I echo and affirm the importance of that approach. And it's interesting, evidence of how different what we're doing with AI is compared to some of our previous decision support technologies. The way that we are governing these 21 things that I mentioned with a long list of others queued up for production behind them is so much more comprehensive because it is that significant. So, that with great, power comes great responsibility, and organizations like ours are taking it very seriously. So, yesterday I had my monthly AI Ethics and Oversight Committee meeting, and you have the head of compliance, the head of legal, the physician leaders, the nursing leaders, other executives. And the things that we're looking at are pretty down in the weeds, which is why it took ramp up time over the course of more than a year to get that group educated to what is it that we're talking about? Why are we worried about these things? And then yesterday we presented to them our first quarterly report card for our ongoing monitoring of the 21 solutions in production today. So we have a multidimensional evaluation that we're conducting on a quarterly basis and reporting back to that group. And that group is also commissioned to report into our IT subcommittee of the board of directors. So we had shared it with them and will continue to do so. So there's a lot of accountability built into that you would never see. Like, sure, we've looked at what the decision support alerts response rates were, and you tried to tune that, but it was very much something that, a CNO talked about with a CNIO, or the CMO talked about with a CMIO. And maybe if there was something really out of whack, somebody would escalate somewhere else. But we have thousands and thousands of alerts firing every day, but there was no the compliance officer gets a monthly report about those things and they talk about it with their peers and what are the implications of it. But we're doing that for AI. So I think there's really strong evidence that states that's not overkill, that's appropriate. But I'm proud of the fact that we've got stakeholders from all those different perspectives being willing to come to understand and take the time to learn and provide us feedback. And then we've got that, again, for us, quarterly review to see, are we still getting the behavior out of these vendors and out of these solutions that we would expect? Are we getting various forms of drift? Have we had reports from our users about difference in behavior compared to original, and so on and so forth? So it takes a lot of work. It's a big commitment for organizations that really want to go deep like this. I'd say you can't do it without doing this, but this was not on people's radar. We weren't spending our time this way individually or collectively at all 2 years ago. You have like an IT committee once a quarter or something like that, maybe, or, it's very transactional. Which project shall we do amongst constrained resources? So this is completely different, but I think I'm proud to be a part of an organization that is willing to make that investment and prioritize that way. And I don't see that diminishing anytime soon.
Awesome. Great insights. So, and I think we had these conversations actually in prep for this, but healthcare's not all roses and rainbows. So I'm sure you've had challenges through the deployment of AI platforms. And I'd love to hear from each of you, what was your top challenge? How did you overcome it? And Dan, let's start with you this time.
One example I'll give just as a representation of a class of problems is with the work we've been doing with our own internally developed chatbot. So we have ChatGPT at its core, but then sort of an ensemble approach with models challenging other models and really looking to improve that. How we tested that internally and then deployed it out to a pilot group and then deployed it out a little bit further and did the right degree of education for, caveat emptor is the wrong thing to say here, but to make sure that our users really understood, this could be very, very helpful. In fact, we are certain it will be, but you also need to be an active, engaged participant in helping us to push us forward here. And so when you see a problem, we had examples where we were actively trying to stump the chump, if you will, with something that was otherwise very sophisticated, and we'd ask a crazy question and get a crazy answer back instead of a response that says, you're asking me about something that does not exist in reality, would you like to ask your question again? And when we started to move into production, but still on limited scale, how do we communicate about those risks and what we were going to do when you found unexpected or undesirable behavior? And we tracked that transparently. And we made sure that, hey, we reported back to our committee, hey, compliance team, just so we have 500 users of the Sharp AI last month. We had 4 reports of some weirdness. We used those and root cause back through the entire instrumentation to figure out why was that. We're redeveloping things here so that we can have, a little bit more screening, and we've given specific, hidden prompts that prevent that thing from happening. And to do that in a way that didn't have somebody pull the cord and say, stop this whole thing. This is all crazy. We shouldn't be playing in this space. See, it's too dangerous. So I would say those sort of fits and spurts there was still, we put a hold on some things, or we sent a note to folks saying, remember, we had said don't do this. We really mean don't do this because this is the type of thing that can happen. But thanks for keeping us informed. And then we keep that moving. So, clearly when we go to do things at a full scale production basis, the scales are, the stakes are even higher. So you got to do that work up front to get to there. But I think it's just really having that internal commitment as an organization that the value is there and the imperatives are we must figure it out, but that we will and we'll work through those things. I'll confess, very difficult conversations with that multidisciplinary team, right? It wasn't, all, as you said, it's not all rainbows to get to a place where an organization's leadership team in a highly risk-averse environment would be willing to keep going like this. But I'm proud of the fact that they've been willing to do that work to help get us to a place where we could keep going.
Terri, what about you? What
Yeah.
are those top challenges that comes to mind?
I think for us, we're a kind of a lean IT shop, and there's this enamoredness around AI right now, and every tech group says they have AI built in. And so there's this kind of this urgency and speed to try to get things done quickly. And I think, it's such an important tension point to navigate, because the pressure to move fast is real, but, especially when you're looking at like workforce burnout, financial headwinds, and all these things that you're trying to address. But, you do have to have a measured speed to this because of the risk. And, if we move too quickly, then we might have things or challenges that might actually hurt us in the adoption. If we don't move quick enough, we're not going to get that ROI that we're looking for, and maybe that fear of being left behind. And so, I think you have to take steps to kind of ensure the long-term success. And and Dan and I both have talked about the governance and the workflow mapping. You can't really underestimate that. It's not just about an IT product being implemented. It's that accountability of long-term ownership that needs to be highlighted, and you need to do that at the beginning and understand what you're trying to solve. And then, obviously doing targeted high impact pilots is, something that will help us kind of understand, is this solving the problem we've intended to solve? And then, learn fast. And so if it fails, move on. But, I think those are things that we're challenged with, and then you have all the other things that keep the lights on, all the things that you have to do that that kind of can be conflicting when you're looking at, products like this.
Yeah, I think like even in the partnerships that we've had together, there's this like consistent feedback cycle, and like feedback is our oxygen of like, and sometimes it could be like, oh, the way that something was implemented or some clinical like detail, like there's so many different elements of the product and the platform that, we want to continue to evolve in. And it's great to continue to get your feedback so that we can continue to get better. We talked a little bit about speed. So Terri, I'm gonna turn it back to you in a second. We're evolving and implementing these solutions at a clip that no one's ever seen. And that is going to put pressure on the IT teams. And I think we've spent a bit of time on that, but that also puts a lot of pressure on the clinicians from a change management perspective. So how are your clinicians handling this pace of innovation and change? Because it's not just about the initial training, but these platforms are evolving also at a pace faster than ever before. So how is your system handling that from a change management perspective?
I can start. So for us, I don't think that there's resistance to what tool we're using. I think honestly, the change management comes around the redesign of the care models that are being used, that these tools are being used to support. Because care, the way we traditionally have seen it, just isn't sustainable anymore. Particularly, I mean, we serve a very rural population, and so we can't sustain all of the demands and the headwinds that are coming at us with the same model that we had before. And so I think that the change management comes at that. And so what we're trying to do is align everything to our strategic plan and have purposeful measurement to accepting these technologies. So we're not just being transformational just to be transformational. We're not implementing ambient technology because we think that that's the next cool thing to do. We have a direct problem that we're trying to solve, and we're aligning that to our strategic plan with hard outcomes that get reported out on. And it's not an IT project, it's an operational project that we're partnering with IT to enable. And I think that's really the only way to do that. If you put this on the backs of IT, there's no way that change management's ever going to happen. I always say that, if you want a project to fail, don't involve operations because they will sunset it, particularly nurses, and I'm a nurse, so I can say that will sunset that pretty quickly. So you want them involved, and you want them to own it. And you want them to be part of that change because ultimately it needs to be kind of muscle memory at the end of the day on how you care for patients.
Amazing. Dan?
It strikes me that in the instance of the deployment of a bridge at scale, the change management is actually almost zero. And it's more just like, how do I don't need any more effusive thank yous. I've just got too many of them, and I've never had that in my life, in my whole career, right? It's just like everybody loves it, and there's pull, right? And as I was sharing the other day, it sets a really incredibly high standard for what's possible. So as a bridge or any other company is trying to figure out how do I infuse AI into some existing workflow, and perhaps also being thoughtful about should that workflow be turned on its side and completely redesigned to achieve the goal we're really trying to go to. In the end, the workflow actors are not technologists, with very little exception, right? The people that are going to be the actors in these scenarios are front desk people. They're clinicians of various kinds. They're the patients and the families themselves. We've seen in the digital consumer realm how many applications come with an instruction manual today? Almost zero. How many users do you have of these massive platforms where people do complex transactions every moment of their life, professionally, personally, otherwise? It's incredible. And so I completely agree with Terri. There's almost no more risk averse health industry vertical segment than healthcare, and particularly domestic healthcare because of our litigious society. But we've got to figure that out, right? So there's models here for how can you take something that's completely transformative, new, novel, and just reinvent something, but do it in healthcare in a way that's still safe. So I think that really is, again, that sort of all that effort that takes place back end to give something that's elegant and delightful front end. And now we kind of have even a worse problem, if you will, because now all of our bridge users, for example, know that that's possible. You completely reinvented the way that I, do my job in an exam room or do a telehealth visit. And that was amazing. And I will never give it up ever again. But I have these other problems too. I feel like you should give me something that helps me that much and was that easy and does that much more benefit. And I'll just keep waiting, bring it along. And that's tremendously difficult, but I think we're here for it. And that it just, again, we've shown a little bit of a sort of reaffirmation of the art of the possible with real innovation. It's like the capital I on innovation has gotten like reestablished. It's bigger, but everything else is kind of down here. We got to figure out how do we do that for our next things. Because I think the tolerance for half-baked stuff is going to be a lot lower, given the fact that now they've seen like, oh, well, why doesn't it feel more like that when I use that as a part of my workflow in which I'm an actor?
Yeah, I've heard this idea that like healthcare is a team sport and it goes beyond the confines of a single health system. And it's just great. Like, I think one thing that we look for in partners, and we have this with both of you, is like joint accountability, right? Like this is a serious endeavor. We are invoking, like we're solving very serious problems, and like everyone has to be accountable. And I think you both alluded to that fact. You obviously need accountability across different teams so that no one feels like they're being forced. And that's what's probably leading to all the thank yous and gratitude messages that you both are getting. Um, the last topic I want to venture into is one that's top of mind to many right now, talking about ROI, return on investment. And I like to say that ROI comes in many shapes, sizes, colors, smells. It's not the same. I think you both come from very different health systems, different parts of the country. So I would love your own unique perspectives on how you think about ROI for a solution like a bridge. And Terri, maybe let's start with you.
Yeah. So I mean, we really try to start with the business case. What's the problem we're trying to solve? I think, AI is a tool set, but it's not always the tool set. So you have to understand, what are you trying to solve for? Rather than just going out to tech to try to have the technology lead that conversation. We also aim for a platform approach. So, we do try to look for the solutions that we already have in-house. But when we look at the problem, once we've identified the problem, we really look to establish key performance indicators around, operational gains that we can measure either through, and sometimes it's hard ROI, like, you can now watch 16 patients through a telesitting program versus having with one person versus having 16 people sit in the room. Like some of that is just real hard ROI, but most of it is not. So we look at things like provider satisfaction, whether that's perceived or not. Perception is a real thing, and are our clinicians happier? Bridge is doing that for us in a kind of a real. I mean, we scaled from like 10 to 200 almost in a month. I mean, it's been crazy for us because they're just so happy with it. But that is real, because if you keep them less burnt out, they're not going to leave you. They're likely going to stay in the industry longer. And then you have that kind of continuity of clinical care. We look at patient access, is the AI improving appointment availability or wait times, or just being able to kind of source the need of the patient. Workflow optimization, is it enhancing or streamlining existing tools where we can add reducing some complexity and getting some other things out of the way and allowing them to work at the top of the scope of their practice. So I think success metrics can vary in a lot of different ways on how you adopt the technology, but I think the important thing is building out that ROI or that KPI at the beginning. If you know what problem you're trying to solve, you should have metrics that you're going to use to see if you're actually solving that problem. And I think that's been a shift, I think, over the last couple of years. We haven't always done that because, something cool came, somebody saw it at a conference and all of a sudden we want to implement it. You implement it, you don't even know what you're trying to solve for. But I think that a bridge has been a great partner in helping us measure that. And it's not just about adding more appointments, because we're not actually making our providers add more appointments. But I think organically, they're able to see more patients because they're getting their notes done, and they're able to sit and actually eat dinner with their family instead of being on their computer. And those things actually have a real ROI that, is something that you may not put a hard dollar to, but it's something that you can feel throughout the organization.
But I think we completely agree on that experience here, but it flows through to the actuarial to say, okay, well, what is provider turnover costs? How many provider vacancies do you have? What's your total panel capacity right now? And even as you're getting incrementals there's some big steps there. Like somebody was going to leave professional practice because they just were sick of it. They couldn't do it anymore. And you have more than one, more than two saying, you know what, I'm not going to go down to part-time. I can stay with full-time. And those have, just for the operational of running a medical group, like that's a big deal. And especially if you're dealing with that at scale, a really big deal. Completely agree with Terri too about needing to define those metrics up front. And that's a part of that worksheet that has to be completed by the business sponsor. Our intake process for I want to do something with AI is, all right, technical partner needs to go fill out their part of it. Business sponsor internally has to fill out their part of it, and then their IT guys have their part to fill out as well. But a part of that is how we'll track the value. And so there's you got to talk about cost. Now you got to talk about sort of key value parameters, like for example, a volume of activity. And we have to define right up front how are you calculating that? So is it like labor hours saved or a quality measure moved and any other additional value measures? And that goes into that grid. And that's a part of that tracking that I talked about too on the quarterly basis for accountability back. We're still paying X per period because we're under contract to do so now. Are we yielding that value? And I'm actually really appreciative of the fact that the AI solutions that we're deploying are not coming in through the back door as freeware. We actually have some risk, and we're monitoring and trying to mitigate the risk around the stuff that just shows up, right? You get an upgrade from some cloud solution, and all of a sudden there's a little agent button in the corner, and all of a sudden you want to know, what the heck? What are you doing with my data? Was that covered by my DUA? Is there any PII, PHI, or just business sensitive data? Are you running it through some public API? Like huge questions, right? And our large, many small to medium partners like don't understand that risk, don't care, maybe. And so that's its own class of stuff. Those aren't mostly the ones we're talking about here, though. We're talking about the abridges or stuff that comes from Epic or stuff that comes from Workday. And they're not just giving them to us because it actually does cost them to use those tokens and it does cost them to engineer those features. So I actually appreciate the fact that it's forcing the business question. We're going to spend a lot of money here that wasn't in the IT budget before. Why? Because I'm going to point the direction and say, we should probably look at this one and that one and not those ones right now. But I don't get the benefit in my cost center more explicitly than ever before. So I think that's been really good because it's brought those folks to the table to say, like, I'm going to run my business differently because I'm 40% more efficient over here. And here's how I will show you the full pro forma that goes along with that. And in contrast with some other eras of IT governance over these decades, where it's like pulling teeth to get somebody to come to the table as a business sponsor to try to figure out how they do their part within that to move things forward, people have a lot of energy for it. So yeah, I think that's been really good and healthy for us, and that will continue.
Yeah.
And I think to add just one thing to that, and I love how you frame that out, Dan. I think one of the things that we're being challenged as an organization to think differently in our business relationship is that contracting as well. So talking about those AI solutions to just show up is we're starting to actually put language in new contracts to say we have to have some sort of approval, particularly when it comes to clinical decisions. Back office stuff is a little bit different, but like if it's using our data to drive clinical decisions, like we need to have some sort of conversation around that.
Yeah, I think the evolution of even contracts is going to, change as like AI becomes more commonplace. You both touched on something that's actually near and dear to us, like thematically around these solutions can help clinicians operate at the top of their license. And I think there's such a seismic change just based on some of the stories that we're hearing on what clinicians they're more free, they're more unburdened, et cetera. And I think like we are just starting to see like what impact that truly can have. There are more standard ways to measure ROI, and we all know those ways, but I think there are very untraditional ways to measure ROI that are coming forth because of the seismic change that is being created. And I look forward to, the coming weeks and months where we can work together to like see what those are. And I think they are going to be very different based on what type of adoption you have, what type of specialties, care settings, what part of the country you're in. So very exciting time.
Agreed.
The last question I'll ask, you inspired me, so I'm going to I'm going to add in a new question here. So as you both know, the note is continuing to evolve. Like we want to ensure that it captures all of the care that is happening in the most seamless way. We're moving into unburdening some of the challenges around rev cycles so that some of that back and forth between clinician and coding team doesn't exist. So maybe tell me a little bit about, as we look ahead to the coming months and we move into this sphere where there's not just a clinically useful note, but a billable note, like what does that mean for your systems, your clinicians, and what are you most excited about? And Dan, we'll start with you.
Sky's the limit, right? I mean, as much as I was joking before, but you would have to hunt for the chart, and you'd have to write in the chart that was the only place that it went, and what did it say, and the rest, and that was a paradigm that had been forever. Now we're like a full generation forward from most organizations had provided some sort of electronic way of doing something clinical, writing a note or placing an order. But we've got a new prison, right? It's that rectangle. It's got a keyboard and a mouse as the input devices for the human, and they're still locked down and slave to there. And I think part of what's unlocking this is like that convergence of mobility, IoT, like the stage is set, like, cloud compute and the fundamentals we've been working really hard on as IT professionals for decades now. But now the table's set for us to really say, okay, how do I sort of assemble not something that's PC centric or even phone or tablet centric? How do I really, it really frees us to really reinvent what it is that we're using, how we're using technology to support the thing we're actually trying to do. So it's exciting to actually sit down and really way back, like go into a room and blank whiteboard in some respects and say, like, let's talk about what are we actually trying to do here? I'm trying to make sure that my patients have all the guidance that they need so they got the right coaching and they make the right decisions so that they're following through on what they need to do to be healthiest so they don't have to come to the urgent care or the ER or the hospital if that's avoidable at all. Like that's a bit the macro, like that's what we're trying to do, right? To promote human flourishing and thriving. So that's a pretty clear target end condition and a desired future state. And it's bound up in all of the parameters and limitations of all those myriad overly complex sub processes. So I think it'll be exciting. Obviously, we can't boil the ocean, right? But we'll look at areas where it's just harder than it needs to be. And I can't staff it, or I can't afford to see all of the patients. So we're having to stratify to only the 2+ chronics, but only for the payers that are giving us some extra spiff to do that. And we've got some, sort of pool. That's so just frustrating and limiting. So, like, how can we take this pantheon of technologies and say, all right, what's the goal? How can we do the best for everybody and have everybody excited and feeling like they're doing good things and having fun doing it? And that's that sort of top of license, but it like fills the bucket, fills the heart, right? People love to do it and they'll keep doing it.
Awesome. Terri?
I would agree. I think what we've seen in the dynamics of how the provider interacts with our patients because of you lifted that ability for them to have to type on the computer for the note. If you expanded that, and we've asked our providers to be, coders, to be, shift through in basket messages, to do. I mean, we've asked them to do a ton of stuff. If you not only allow the provider to enjoy the interaction with the patient, and then you take away the burden of coding, and then you take away that noise of the coders actually saying, hey, you didn't document this, or, and then we actually get paid for the work that we're doing, and we can reinvest in to our facilities in the care that we're doing. I think, there's an endless kind of, and then, because I do think that it's, there's a lot of synergies. We're super excited to bringing this into the inpatient space. How does that impact nursing? We use computer vision in our rooms. How does that integrate? Can we have both the eyes and the ears and then translate that into documentation so that our nurses don't have to feel that burden? I mean, I think that there is real opportunity here. And it's really about talking to us and having, partners like us who will prove it out for you. And just, aligning it with our clinical staff to get the adoption. But I have people every day ask me, are we getting it for the inpatient, or when's nursing coming? Because that's just, I mean, it's
I've had 3 of those emails this morning and I'm not exaggerating.
yeah, I mean, it's a real thing because they're seeing the benefit. And I tell you, the buzz is so large right now. And I know we've only been on a bridge for a few months, but I can tell you we have a wait list to train. And so that's exciting. When you say you've totally changed how they care for patients. I've actually experienced it as a patient myself. My provider leaned in, kind of leaned on their arm, was looking at me, talking at me, and I'm probably very acceptable, allowing them to document because I know, but the experience was it was so real. Like it is different. And I think, when you bring the joy back into medicine, We're all in it because we're compassionate people. We want to care for people. It takes all the nuances away. You know, I think we're at really an influx of what this can do.
Amazing. Well, it's been an absolute privilege to converse with you both. I learned things that I didn't know before today, and so I look forward to continuing those conversations. Just to summarize maybe some of the major themes, I think strategic clinical integration of a platform into the right place, the right time, in the right way is obviously very important. Obviously executive partnership, but also like clinician involvement. You know, they're the ones on the ground and making sure that they are accountable with us. Looking at, you know, ROI in a very pragmatic way that's near and dear to a specific systems approach, I think is important. And I'd say lastly, like, you know, we need to continue to dream together. I think let's knock out some of the initial problems, but we're scratching the surface, and I'm excited about what healthcare could be as we continue to dream and innovate together. So thank you both for your time today, and I look forward to our future conversations.
Thank you. It's a pleasure.